I hope everybody is ready to hear from our guest speaker, Dr. Gina Pritchard. Hello. She specializes in cardiovascular disease prevention and treatment. Sorry. She has developed protocols for the clinical application of early identification and phenotypic description of cardiovascular disease. Her integrative medical wellness protocols include cellular medicine, micronutrient, hormones, thyroid optimization, peptide, and small molecule therapy, evidence-based on biohacking techniques. So please welcome Dr. Gina Pritchard.
Hello, everyone. Let me share my screen. Can you see my screen?
Yes, we can. Thank you.
Awesome. And you can hear me just fine?
Yes.
Awesome. And you're ready for me to start, correct?
Yes.
Okay. Yay. Hello, everyone. I'm thrilled to be here. Thank you so much, everyone, for attending and for having me today. And I want to start with the question. I want to ask you, how many of you, and I mean, I'm in the radically healthy and focused on limitless living people. So I know what your answer is going to be to this, but how many of you, if you knew you could find out if you can have a healthy heart, a body that works well for you, and a body that you love for the rest of your life, unlimited, well beyond 100 and 120, would you want to know? If so, say that's me. Yes, 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 I would want to know. There's so much available to us today that is not widely known about. Some of the things I'll talk about, y'all will have heard of, and some of the things you may not have. Some of the things are simple, and some of the things are a little bit more complex, because I do think we're even making more headway looking at the cellular level, as was just mentioned. But I practiced traditionally for over 30 years. Most of my work was in the hospital in the coronary critical care unit, where there was a steady stream of people having chest pain and heart attacks on a daily basis. A steady stream. It seemed like constantly coming through the door, new admissions with people in a large teaching hospital with heart attack. And so after many of years of this, of saving people's lives, I loved it. If you're having chest pain and a heart attack, the hospital is the place to go. It is still the greatest technology in the world. You can save your life by getting to the hospital quickly. But after years of that, I realized this was a little bit of an assembly line. And once people had their first heart attack, I was not helping them very much, because we knew they would be back for a second one or for a second stent procedure, another bypass surgery. It set them on this path for life that was not good, a reduced quality of life. So I don't practice that way anymore. I ultimately left the hospital after opening a prevention-focused clinic. I'm now focused on the root causes of these problems and reversing and stabilizing cardiovascular disease. So before I get into a little bit of a more technical aspect of the talk, I just want to say that in this a protocol that I have called the Blessed Life Protocol, there are 7 verbs that are incredibly important for all of us to live the rest of our life very, very healthy, and to live forever healthy. And many of these things were talked about last night, and I was so thrilled to hear that. And some of them are very simple, like breathing. We all know that we need to breathe. Of course, we don't even have to think about it. We breathe. But if we could focus more intently on breathing slowly and intentionally and through the nose, it would lengthen our life and improve our health. So how are we going to do that? Life is busy. I'm here talking to you. I'm not thinking about breathing through my nose. I have a pro tip. Does anybody have an idea of how we could remember to breathe slowly through our nose? Many of you have probably heard this, but it's to hum. And so to hum would actually help more than one of these things. It's hard to be unhappy when you're humming. You may irritate other people around you, but if we're humming, we're breathing slowly and intentionally through your nose. And then, secondly, to love. We talked about this last night as well. And whether you define God as the spiritual aspect of life or the divine being or differently than I do, that's wonderful. I'm not pushing any agenda here. I'm just saying, and it was talked about last night, that there is this divine nature that we love and loving ourselves and loving others. Okay, so one other thing that was talked about last night, my pro tip, is what else can we do or what can we do to love others more? I just want to say that there is not enough. I see patients all the time, and there is not enough unconditional loving sex happening in the world. I'll just say it, I'll put it out there. So we should all embrace more of that. I don't have time to talk about everything, so I'm not going to talk about eat, sleep, stress, and exercise. But next, I'm going to talk about in the discovery aspect of these 7 verbs for health. In the biometrics category, what can we learn about our body? Some of them are simple. Blood pressure is an example of that. Wearing a continuous glucose monitor is an example of that. Measuring your waist is an important biometric. But we also have metrics that are at the cellular level. That's where the life-saving work is getting even better. So one pro tip that you can measure that is not commonly known is the farmer's carry. If you've heard of the farmer's carry, raise your hand. We all need to stay strong the rest of our life. And so if you can carry 50%, that's 50% of your body weight, one weight in each hand, and just walk around for a minute, that is great for longevity. Well, I thought, okay, I'm going to just do that. And I weigh between 100 and 120 pounds, depending on how much muscle or lack of muscle I have on my body. So I thought I'm going to start with 20-pound weights in each, 40 pounds. I could not do it for a minute, just walking around, just simply relaxed and carrying these weights in my arms. So I had to go down to the 15-pound weights and start with 30 pounds. And now I'm working my way up. That's just a pro tip. So why, after all of these years, is heart attack still the top killer? It's because traditional medicine is still focused on an inaccurate target and an inadequate treatment plan. They don't include all those things we talked about, but more importantly, I want to talk about, there's many new metrics that are saving lives, but I'll talk about one in particular. But if we start with the poor target, of course, we're going to end up with an inadequate treatment plan because we don't even know what we're aiming at, or we're aiming at the wrong thing. I'll give you an example of that. The whole world is focused on lowering cholesterol, on lowering LDL, lowering particle size, and heart attacks are still the top killer. We know that's not the answer. That's not the right target. Lowering blood pressure is important, but that doesn't necessarily mean you won't have a heart attack just because you lower blood pressure. Losing weight, gaining more muscle, these are all great things, but it doesn't tell us if we're reversing cardiovascular disease. But AI has changed this. 2 examples, unfortunately, of what I'm talking about are these 2 individuals. Perhaps on the left side of the screen, you have anybody heard of Tim Russert? Do anybody here remember Tim Russert, the news anchor on Meet the Press? Well respected, dearly loved. And at age 58, he was going in one morning to get ready for the news, and he collapsed on the floor and unfortunately could not be revived and died from a heart attack. 2 weeks earlier, he got a clean bill of health from his cardiologist who said he had mild plaque but was on medications. So obviously, the target was missed and medications weren't the answer. Tim Russert had adequate to any doctor who he wanted to see, the best, I'm sure, of traditional medicine. On the right side of the screen, maybe some of you have watched The Biggest Loser in the past. And Bob Harper, who is the celebrity fitness trainer on The Biggest Loser, was working out one day, not on the show, but just in his normal training routine, and collapsed on the treadmill. And he had a heart attack. He also had to be revived, but fortunately he lived through it, and you can find him on YouTube today talking about his experience and how it has left him, as I said, with a certain amount of insecurity in his life. But he had previously shared on the show how he had had excellent labs and testing results. So how can somebody be perfectly fine this morning and have a heart attack before noon? What's going on? This is the target that we're missing. We're not focused on the place that a heart attack occurs. Heart attack doesn't actually occur in the heart, but it occurs in these coronary arteries, the heart arteries in the wall of the artery that gives the blood supply to the heart. When blood supply is impacted because of this, that's when a heart attack can occur suddenly. And so this is the lining of the heart, and I want to show you a better picture of this using this video. In this video, I'm going to mostly, I'll talk while it's going through the pictures, but it's going to take us on a journey like we were a blood cell or the blood supply going into these heart arteries, traveling down the vessel in the inside or the pipe of the vessel to give the blood supply to the heart, and then the heart pumps it ultimately to the rest of the body. So this is a heart artery, and when I stop here, you can see a picture just like what I showed you before, where the blood flow is adequate, the muscle layer and the lining that protects that is healthy. This is where plaque would reside if plaque were present. This is a normal, healthy artery that, like all of us, want to have for the rest of our life, for eternity. Next, we're going to see what's called a stable plaque. So when plaque forms on a cellular level, the body has the capability to heal that. The blood vessels have the capability to expand, as you can see here, so that blood supply is maintained, opening up a larger hole, if you will, a larger pipe for blood flow, because the body senses that there's a problem on this side of the wall of the artery. But when we lay down scar tissue, ultimately, it begins as just a thin, sort of laying brick by brick, laying down this covering. The body realizes this has got to be dealt with. So while, like a wound on your skin, the body realizes first it's going to get bigger and maybe more like a blister, larger, could possibly pop before the body begins to heal it, shrink it down, and lay down fibrous tissue or scar tissue. That's actually occurring inside our blood vessels when plaque starts to form. It's like a sore or a lesion on the inside lining of the artery that can look like this. This one's been here a while though, because the body is healing it over and developing scar tissue so that this plaque can ultimately the entire thing becomes scar tissue, and it will be a very low risk plaque. Like a scar on your hand, you saw, yeah, that's where I cut it when I was 12 years old, but it's not going to cause me a problem now. That's what we want if we have plaque. We want it to become low risk scar tissue. This is going to show us a dangerous plaque. You can see the difference of this one is there's a lot of activity inside of the plaque. These are white blood cells and small particles, those measures that everybody's wanting to try to lower the number of. It's not lowering the number, it's improving our cholesterol and LDL particles and our white blood cells' ability to heal this and heal it effectively. So not only is there the immune system trying to heal this plaque, but there's just a very thin layer. The body has not had time yet to seal this over. And that's where the problem occurs. When you're in this stage, it's a high risk, vulnerable plaque because the little covering can rupture and then the body forms a blood clot. You'll see that happen now. This little lining will rupture and then the contents start to pour into the pipe or the area where there's supposed to be nothing but blood and the nutrients in the blood. So when this happens, the body sees this as an emergency that needs to put a little tiny blood clot on it to seal it over right quick so the healing can continue. But rather, what happens oftentimes is an overly aggressive blood clot formation. And so where that blood flow was adequate a few minutes ago, then in just a few seconds or a few minutes, it can occlude or 100% block that blood flow entirely. And that's where the problem occurs. This is another picture like we just saw, and this is a human anatomical picture of a person that had a heart attack. And this blood clot that sealed over where the problem occurred did fill the entire lumen initially, and part of it fell out as the specimen was being prepared for the photography. So you can see in real human tissue what that looks like and how that Tim Russert and Bob Harper could have had that problem. But I want to show you that now we can see this very target with our own eyes, thanks to the help of artificial intelligence that can analyze these artery walls that are like 1 millimeter thick. The area we're looking at, 2 millimeters thick, 3 millimeters thick, very tiny. This is an example of a gentleman that in 2010 had a wide open blood flow. So this is a coronary artery. You can see this is the pipe where the gray area is, plenty of room. And there's a plaque on the wall of the artery. It looks like it's on the wall of the artery. It's actually in the wall of the artery. Remember how I said the body has the capability to expand these arteries to allow for blood flow, and it also has the ability to push the plaque into the wall of the artery. So the outside of the blood vessel is actually here, and here's blood flow, and here's the plaque. Plenty of room. When it's yellow like this, it's a moderately risky plaque. But in 7 years' time, he had developed this red indicates that some of this moderately risky plaque is becoming more unstable now. It's a dangerous plaque, not moving towards scar tissue, but the other direction, the direction we don't want it to be. That's our target. That's our goal, to stabilize this gentleman's plaque so it becomes nothing but scar tissue, and then this will open back up again. He's also reduced the blood flow over time. So he was not practicing our 7 verbs like we just talked about. Probably didn't know about them. This is an example of doing all of the things that we know to do to improve arterial health and heart health in 1 year's time. You can get marked improvement. This person has blood flow that is somewhat reduced and a large amount of plaque, and much of it highly dangerous plaque, as you can see with the red there. But in 1 year's time, this plaque is much improved. The vulnerability or the dangerous component of the plaque is improved, and the blood flow is better. So making some changes, that not just adding medications to it like what Trim Russert had, but identifying all of the root causes and contributors can make a huge difference in 1 year's time. So I want your future story to be different. I want my future story to be different so that we can live forever, and that we can have a healthy heart, a body we love, and a body that works well for us the entire way. So using artificial intelligence and cellular analyses has really added a lot of power just in the last few years to our effectiveness at preventing heart attacks. And if you've had the first heart attack, to prevent a second or a third, that's for sure. So you can find me at thepreventclinic.com. I would love for you to book a call there. I talk to people on a daily basis, just complimentary, to answer your questions or to see what maybe recommend next steps, or see, answer your questions. I'm available at certain times that have been allocated for that. And also I'm happy to take questions now, if that's appropriate, Mariana.
Yes, it is. Thank you. Thank you so much. Thank you. That was great information, Dr. Pritchard. So who wants to go first? Vanessa.
Hello, back here.
No.
My question to you, I'm 37. When should you get these scans done? Or is any age really? Doesn't matter when.
Excellent question. And I'm so glad that you stood up and asked it and that you were first. So I have an interview on YouTube where I interviewed the medical director for one of the researchers that developed this artificial intelligence. And I sort of shyly said to him, I said, I think everyone age, I don't know, 40 or 45 needs to get this test, because heart attacks occur after cardiovascular disease has already been a problem, or the contributors to cardiovascular disease has already been present in this person's body for 20 years, 10 years, 30 years. And so if we started looking at individuals in their 40s, because the average age of heart attack is 55 for a male and 65 for a female, then if we started looking at age 45, I think it would help save lives and prevent the first heart attack. And he wholeheartedly agreed. So that's just a random number. We don't have science or any evidence really to tell us when, but can say I have had some individuals, a lot of individuals in their 40s and some individuals in their 30s who just had an early, their father, for example, passed away at age 48. That's not common to pass away from a heart attack in your 40s, but I've seen it in the 20s and the 30s and the 40s in certain circumstances. So my answer to that question is at least by age 40 or 45, maybe consider it sooner if you've got an early onset heart attack in the family.
Thank you. Anybody else? Dimitri here?
Yes, hi. I actually have
Hi.
3 questions, but let me start with one.
Okay.
So you hear the role of cholesterol or high cholesterol levels in the blood that have to do with clogging the arteries. Then you also hear the role of inflammation that have to do with the same. Can you speak a little bit to that? Because I'm kind of confused. Is it more inflammation? Is it more high levels of cholesterol? Because then you hear also that cholesterol really doesn't have much to do with it, that it's mostly inflammation. But so I'm kind of unclear as to what it exactly is. Can you speak a little bit to that?
Yes, another excellent question. Thank you so much for asking that. It is honestly an area of intense interest of mine right now, a passion, if you will, because one thing that we can say for sure is lowering total cholesterol, lowering LDL, the bad cholesterol, which is really a terrible term for it. But anyway, lowering LDL and lowering ApoB, or the more dangerous type of LDL, supposedly, hasn't worked for all these years. People are writing prescriptions for statin medications right and left, getting those numbers down. And we know that that increases your risk of dementia over time. Not a good practice. And lowering those numbers haven't dropped the heart attack rate. And so more and more research is being done in this area. And in a lot of my work, I cite those sources, but right now one comes to mind by Dr. Berghoff and Dave Feldman, where they looked at individuals that allowed their LDL to actually rise, and they did these CAT scans like what I just showed you with the artificial intelligence to look at plaque, and they looked at it in a relatively short period of time, 1 and 2 years. And the plaque was no worse in individuals who lowered their LDL and their ApoB and those who did not. So people describe it as firemen on the scene of the fire, like the LDL are the firemen or firewomen, the firefighters on the scene of a fire. They didn't cause the fire. The LDL didn't cause the fire, but they were implicated because LDL's on the scene. And now we know, as you mentioned, it's inflammation and oxidation. The immune system gets overwhelmed by this plaque, what we just saw, this unstable plaque in the wall of the artery. The body is using everything possible to treat it, to reverse the process before things get worse with the immune system, inflammation, and oxidation. It's a good thing. It's like when your wound on your hand looks worse before it gets better. Oh, then it finally heals. That's inflammation and oxidation. So it's the activity of LDL at the wall of the artery. It's not lowering the number. I will stand on that until proven otherwise. That we do have enough research to show right now, but it's not widely communicated. Did I answer that?
Yes, absolutely. Thank you.
Clearly?
Here's my second question.
Okay.
What would be the best way to train and work specifically, I guess, the smooth muscle in the arteric system, both, major arteries and veins as well as microcapillary? I mean, the research things like regular level, low level cardio, does that do anything? Does it have to be, hit or interval? How about cold exposure, like cold dips, etc.? How does that, in your opinion or to your knowledge, how does that all work? Or simply, what would be the best way to maintain a strong arteric system?
Yes, great question as well. So the answer to that is all of the above, but let me put some parameters around that. So we do know that just a 20-minute walk at a brisk pace, not a stroll, but a 20-minute walk or something similar to that, a bike ride that isn't to hammer it out and get the heart rate to a certain level, is great on so many levels. It is some cardio, it's moving your body. It's usually blissful, especially if you're listening to something you enjoy listening to, or you're meditating, or you're humming while you're doing it. And so that on a daily basis. Secondly, to do as you mentioned, high intensity interval at least twice a week, a reasonable high intensity interval. There are people that have wacky protocols, but some where we do stress the heart for 15 seconds, 30 seconds. Maybe you build up to even more than that, and then you recover for that twice the amount of time. So if you do all out for 15 seconds, or let's say 30 seconds, then you're going to slow down and just walk slowly for a minute and then do another 30 seconds. So, and no more than 4 rounds of that, and building up the amount of time you can do that high intensities, no more than a 12 to 15 minute workout usually. You can do it on the Stairmaster, you can do it on treadmill, you can do it outside, you can do it going up a hill. On some steppers that will allow you to do that. So walking, high intensity, we have to hold on to muscle. That's why I mentioned the farmer's carry. It's just an indication of, are you doing an okay job of holding on to muscle? Muscle is indeed the currency of longevity, one of the currencies of longevity. And so building muscle, a couple of days, 3 days a week, something like that. And then cold plunge, that you mentioned some of those biohacking techniques. Red light therapy has data behind it to suggest reduction in cardiovascular disease, reversal of cardiovascular disease, and reduction in heart attack risk. So has cold plunge. So many of the biohacking techniques I recommend as well. So I don't just mean to give it a blanket yes and all of that. There's a reasonable approach, but all of those things have their place.
All right, thank you.
Mm-hmm.
We have time for 2 quick questions. So, Bruce here.
Thank you. So, quick question. What kind of supplements do you recommend, and there are supplements that you don't recommend?
Great question. So without a doubt, vitamin D3 and K2, very hard to get toxic on D3 and K2. So just ignore that data. Most of us need more vitamin D3 and K2. All of the B vitamins, but in particularly B12, and most of us, if we don't know our genetics, need to get that activated form, the methylated B12, methylated B vitamins. Important for so many reasons. In the last 2 years, have become a big fan of subcutaneous injection of NAD for its benefits at the mitochondrial level. Let's see. Some people need more of B3 or niacin. You've heard that talked about, not to lower cholesterol, but to inactivate that corkscrew-shaped protein on some LDL particles. That I recommend sometimes. Let me think. Coenzyme Q10 over age 40 in the form of ubiquinol, because all of our muscles need it, and particularly the heart as a muscle needs plenty of ubiquinol or coenzyme Q10. Love glutathione. Those are the ones that come to mind. I'm a big fan of peptides, which I know Natalie's going to speak about tomorrow. That's been a nice adjunct to what we do. Collagen and creatine. I like recommend both of those often. Yeah, that's what I'm thinking of so far. I'm sure I'm missing some. Wasn't ready for that question, but it's a very good one. Any other you want to say? What about this? What about that? May have just forgotten some.
All right, thank you. Well,
Okay,
let's get
quick
Audrey.
question. Thank you so much for all your information. It's fantastic. Thank you. And you're fun to listen to. I had done a full body scan at Radfest. I think it was the DEXA or something, and they had found 0 visceral fat, which I was really surprised. I wondered how that related to plaque, because I know in my family history there's some, early heart attack, but I get the feeling from what you're saying that a lot of that is genetic and is also what we put in our mouths, like what we take in our diet, the plaque. I just wondered how that related, visceral fat with plaque, and how that's, thank you.
Yes, great question. So first of all, even though it runs in families, I know that this group knows this, but I just have to say it's our epigenetics, the way we talk to our genes, the way that our genes talk to each other. It's what we do on a daily basis, as you've just said. So genetics are not your destiny. You do not have to have that manifested in your life for sure. And it is many contributors in the lifestyle category and otherwise. But visceral fat is visceral fat and the amount of muscle, which usually they go hand in hand, not always, but usually visceral fat goes up as, you know, lean muscle mass goes down. So increasing muscle mass and decreasing visceral fat definitely is tied to lower incidence of heart attack. And it's too soon to say, particularly with this artificial intelligence analysis of the artery wall, if it's related to higher risk plaque, or are there lower risk plaque if we do drop our visceral fat and build muscle. We think so, but we don't have strong data to support that yet. But in general, absolutely, more visceral fat, more likely to have cardiovascular disease and a heart attack.
Thank you. Okay, let's go ahead. Lorna, Marty.
Hi, thank you. Is the AI testing, what tests are those, and do regular cardiologists offer them?
So when I started offering it, because I was just waiting for it to become clinically available, I knew it was in the research model about 2019. But more and more cardiologists are starting to embrace it in primary care, and certainly functional medicine are starting to embrace it now. The artificial intelligence research then was purchased by a company, and y'all may have heard of them, called Cleerly, Cleerly, cleerlyhealth.com. So you can go to that website and put in your zip code, and it'll show where around you can have it done. And you can go, like, people come to me all the time just for that test. They don't necessarily become my patients. Some of them do, but they just want that test. And I would say it's also equally important that you make sure you get good interpretation of the data. That's something that I've developed a course for my healthcare colleagues about, is make sure that the patient understands what the target is, what they're going to do about it, and what to look for when you evaluate again. But cleerlyhealth.com would be your best resource to find someone in your area. And I would say cardiologists that are doing the test, this is a blanket statement. There are some that are fantastic, that this is not the case of, but if they are starting to embrace it, many of them are still fixated on, I don't know anything else to do unless it needs a stent. So we'll see you again next year, and here's your statin, which is not the approach we want. That's not saving lives now, and it won't save lives even with our artificial intelligence analysis.
Quick question about you sort of mentioned niacin a while ago. What do you have to say about the efficacy of the niacin protocol in fighting plaque buildup?
That's a really great question. It's a question in my mind, and I think we will. It's kind of like the gentleman earlier that I answered, that we'll know over time, and even the visceral fat question. Now that we can see what is actually happening to the plaque at the millimeter level, year one, when you look again, some people we wait 2 years or 3 years, but if you look at the artificial intelligence analysis again, your goal number one is no new plaque. Then we know we've stopped the process at least. Goal number two is anything that is dangerous plaque is at least looking moderately risky now, or maybe even scar tissue plaque. Let's stabilize that plaque. That's how we know now we're reversing the process. And so we don't have the answers to the question that you just asked, and many others. Like, so does niacin relate specifically to reversing the disease process and reducing heart attack risk? We think so, but honestly, we don't know. That could be proven to be false. I don't know yet. The study I mentioned earlier with Feldman and Berghoff, they are innovators to just say, we're going to do this test looking at the cellular level with LDL cholesterol. So I applaud them for that. So all of these other studies, people have looked at garlic, they've looked at testosterone, they looked at turmeric, some other things, but we'll just know more as we go along.
Thank you so much, Dr. Pritchard. Thank you for
Thank you for
answering all your questions so kindly. And I also want to remind you guys that we're gonna have this, we're gonna have all this information in our website. We also gonna send an email with Dr. Pritchard information again, so you can have access to the website. And that's it for now. So please, sorry.
Hi, Dr. Gina. This is Jim Stroh. Okay, thank you
Hey,
so much.
see
Yeah,
you again.
really great you coming on here, and maybe sometime you'd be able to visit us in person. We would love that. But I'm glad you were online last night too. You've done a great job. We really appreciate it.
Oh, thank you so much. Great to see you again. And thank you for inviting me. It's been a wonderful experience. And I do hope to come in person.
He's
One of
talking.
these.
So okay, yeah. I have one quick question for you. There's a doctor, I can't remember his name right now, but he did a whole article a while back on how to prevent heart attacks or strokes, how to try to avoid them. He recommended, one of the key things was recommended not a statin, but maybe a more natural type of form of that, like natokinase or Beluki, to take at night, and then take in the morning some vitamin E, a specific kind. Is that something now that was he called it a preventative method. Actually, there's another name for it. Bulletproof, to bulletproof yourself against stroke.
Oh,
It
yeah.
can happen through the night many times or early in the morning. So what's your
Yes.
thoughts on that protocol?
So yeah, I think that natokinase is excellent. And it ran through my mind when the person asked the question earlier about supplements, but I don't blanket recommend that because it can make you more likely to bleed. It's kind of like baby aspirin somewhat in its effect. So unless I know the individual and kind of their lab work, it might not be a good idea to recommend that for everybody, but I'm being overcautious, really. Most of us can use natokinase and it's just fine. And what we saw in the video, where an unstable plaque then ruptures and calls in the blood clotting mechanism, that's where natokinase works. So he's exactly right, the person recommending that. It can keep that blood clot from becoming big. It'll just be nice and small like it's supposed to do, seal it over, and you continue sleeping through the night and you never know anything happened. That's how our body is beautifully designed to help us.
Yeah.
So natokinase is not a bad idea at all.
Well, he recommended over
Vitamin E.
because of side effects with aspirin too. You know,
That's right.
and it's kind of like risk, versus benefits, right? So if you're doing, if you've got already taken a blood thinner, obviously, or something, you don't want to take natokinase on top of that. But if you just have a normal blood, markers, etc., that's where he recommended it. And generally speaking, for most people, then in that situation, is that something you would say is correct?
That is correct. Very well said. Absolutely. Yes.
Well, thank you again. It's been great. Wow. Look forward to
Oh,
more interaction with you, and you'll be getting a call from me.
oh, wonderful. Thank you so much.
Thank you very much. Bye.
Bye.